son of a... You gave me herpes!
Peter, the worst nurse ever, whatever this disease is, and plenty of other wild moments that may make you gasp. Today, we are back at it, breaking down all of the hilarious medical scenes and ridiculous injuries from Family Guy. All right, let's dive right in.
Look, I don't really feel comfortable sharing my health problems with one of my buddies. Can I get a different nurse?
You're in a hospital, Glenn. Anything you say is private and confidential and legally protected by
Don't say it.
hippopotamus.
Hippopotamus. No, HIPAA. It's a law that we have that basically protects the sensitive information of a patient. Okay, and there's other components to it, but that's like the general part of it. So doctors won't wear white shoes typically because they're going to get messy with blood, guts, poop, snot. Typically you want to wear something that's actually just whatever color. Maybe it's a uniform that the hospital's making you wear, but something that you can actually wipe off and clean.
You know.
Sure.
And I don't have a prayer of finishing unless I kick it up a few notches, like weird notches.
Oh my gosh. At the hospital now, we used to use pagers. Hospitals, these little cell phones that were at the hospital, but everybody would lose them. Now they actually have it so you can use your own cell phone as a physician, and all the calls get forwarded right to your cell phone. But patients think maybe that you're on your own personal phone, but it's like, no, I'm getting hospital numbers. So I'm like, hold on, I gotta answer this.
Okay.
Mrs. Fletcher ends and Watchmen starts, which scares me, but now it's too late because everything's,
Oh, my stars.
Hold on a second, I got a text.
I don't know exactly what's happening. So for me at the hospital, does this happen where maybe I have to pay attention? Typically not. As an ER doctor, we're trained to kind of just be aware of everything going on around us. Sometimes patients will just tell a story, long-winded stories. Unfortunately, we are trained, and I'm a New Yorker, to be able to interrupt at the appropriate times to kind of redirect the questioning to get specific answers that we need relating to your health versus like, hey, 10 years ago, this happened, this happened, this happened.
Hey, how foon would it be if we waved sticks around?
I really don't know what we're doing.
It's foon from the word before. I don't see what...
Oh my gosh.
First, let's take your blood pressure, because that's like our favorite thing to do around here.
Oh man. If somebody came to the emergency department with a foreign body stick in somebody's eye, you want to stabilize that bad boy. That way it's not just like willy-nilly flopping around. You're gonna eventually get the vital signs because you need to know heart rate, blood pressure. You need to know what you're dealing with, respiratory rate, temperature, that sort of thing. Obviously there's going to be a globe rupture, a rupture of the eye itself because there's a puncture wound to it, and it is dirty, it is foreign, so there's definitely going to need some antibiotics. Now the question ends up being, where was it injured, and then is the retina injured? You need an ophthalmologist. Oh man,
Okay,
what
your turn.
the? Oh my gosh, like blood brothers. Yeah, no, please don't do this. We do not need people mixing blood. That's how diseases are spread. Bloodborne pathogens, right? The big things, HIV, hepatitis B and C, those are your big ones that you worry about. There's definitely other bacteria out there you can share. Please don't do this. And obviously now you have a cut on your hand. You're gonna leave it open, or do you need to come and see me in the hospital and get it sutured closed?
I think we should hold hands more often.
There you go. We're blood brothers now. You happy?
Actually, yes. I mean, I really feel the bond, Brian.
Just having a little kid, right, having access to knives, probably not the smartest thing in the world. If a kid at that age comes to the emergency department who had access to a knife, Child Protective Services are definitely going to be called, and you're going to get questioned a lot as a parent. Aww. Whoa.
What the hell?
Ow!
Ew, what's this?
Has he got herpes?
You son of a... You gave me herpes!
Typically, you give somebody the herpes 1 virus when you have your own outbreak on your face and then pass it along to somebody else via like kissing, touching the face, where there's another open sore area. Same thing when you get herpes simplex 2, which is basically genital herpes down below. Again, same idea. But just remember, you can always give the virus down there, and you can vice versa give it back up the other place.
What? What are you talking about?
When we swapped blood, look at my lip. It's a disgusting herpes sore. And now I have some very uncomfortable phone calls to make.
Anybody that you might have kissed or been partners with, you should definitely let them know that you had an outbreak so they can get themselves checked out. That goes for any STI.
Look, it can't be my fault, Stewie. I don't even have herpes.
Oh, yeah? Let me see.
Hey, what are you doing? Stop it. at you! You're more herpes than dog!
You're more herpes than you are dog. People try to hide it. Male genitalia, obviously difficult to hide, but female genitalia, sometimes it can be obviously in an area where you can't see because it's inside.
You knew you had herpes, and
He knew he had herpes and he shared it.
Relax, it's not that big a deal.
So I will say that a large population of society has the herpes virus within their bodies. Not everybody has an outbreak of that. So typically, herpes virus is not spread via the blood. I guess there is a theoretical risk that that could occur with blood transfusions like this, but most of the time it is basically like contact of the herpes virus to an open area.
Are you even listening to me? You've got to stop coming home so late if you can't get up in the morning. And
That actually could happen, one, from being super tired, but another is just being woken up in different stages of your sleep. So if you're woken out of like your REM sleep or very deep sleep, you're going to be like groggy and be like, I don't hear anything. But you also could hear it if you've ever heard of something called tinnitus, which is high-pitched ringing of your ears due to typically damage to the ear itself. Kind of scary to wake up and you like not hear somebody's voice. A lot of people worry about having stroke. Typically, if it's just your hearing, it's unlikely related to a stroke. Could it have a specific area of the brain? Possibly, but typically it's probably some other reason why. Obviously, if you're on fire, stop, drop, and roll, right? Smother it out, get checked out for the different degree of burn that you got.
Oh, God, I can't hear Garfield.
Wow, here we go. So there's different types of hearing loss. Typically there's sensorial neuro or conductive hearing loss. It has to do with how the sound is transmitted and then perceived. Is it a neurologic problem, a nerve issue, or is it related to like the bones of the ear and the different windows where things have to move and the air moves and sound?
What's going on? Can he fix it in time for me to DJ at the music festival?
no,
What?
no.
What?
If somebody's actually having difficulty with hearing, we actually would like rub our fingers near the ear itself and see if somebody can actually hear that. And then you can actually use something called tuning forks that will help to determine the differentiation. Is it basically conductive versus sensorial neuro, in the sense of if you smack the tuning fork, do they hear high pitch, low pitch? Family Guy, we know we love it. This is amazing. If you guys enjoyed this, do me a favor, binge watch this whole playlist right here. And as always, definitely subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.